Good morning, good afternoon, good evening for everyone. I am Esther Kishmodi, Chief Executive of Sexual and Reproductive Health Matters. I'm joining you from Geneva, Switzerland, and I really welcome all the panelists who graciously accepted the invitation to this webinar that is addressing the global impact of the Trump executive orders on sexual and reproductive health. We will have 1.5 hours for this discussion, and I will introduce the panelists as we are going around in the discussion. I think many of you really welcome for everyone who is joining this webinar from different parts of the world. And just wanted to say that those who might not be able to stay for the full 90 minutes, the webinar will be available on our website as well later on. The topic of the webinar is really to looking at the nature of the Trump executive orders, how they are situated, and talk about their content and their impact in various parts of the world, globally and within the US, how it's affecting already vulnerable populations. And we will talk about reflections, what can we do, possibly about mitigating the harmful impact and the human rights violations that these executive orders directly or indirectly causing around the world. I'm turning to our first panelist, Mindy Jane Roseman, who is the Director of International Law Programs and Director of the Gruber Program for Global Justice and Women's Rights at the Yale Law School. And Mindy is also the Associate Editor of Sexual and Reproductive Health Matters. Thank you so much, Mindy, for joining. Can you please give us some introduction and talk about the nature and legal standing of the executive orders, how to understand them in the context of the rule of law, how they are politically situated, and how do they matter?
Thank you, Esther. That's a great question to start us off, and I'm going to just give you some background. Please forgive me if I'm speaking quickly. There's a lot to cover. There's a lot of us, so I want to do it quickly.
Don't do it too quickly, Mindy, because
not too quickly. I will try to be legible. So executive orders are official documents through which the President of the United States manages the operations of the federal government. The directives cite the president's authority under the Constitution, which is Article 2, which vests the president with executive power over the government, including the obligation to take care that the laws are faithfully executed. Executive orders are then published in the Federal Register, and they may be revoked by the president at any time. Now, in the US constitutional design of separation of powers, executive orders have a limited role. They cannot override federal laws or statutes. Statutes have to be passed by Congress and then signed by the president, or if vetoed by the president, then Congress must override the veto with a bill to become law again. And executive orders are not meant to preempt this process. And the Constitution gives Congress absolute powers over things like taxation, spending, and certain war powers. That said, the president also has limited powers that Congress can't override, such as his veto power and the pardon power, but none of the executive orders that we're going to discuss have anything to do with Trump's absolute powers under the Constitution. So the big question is, what is Trump doing legal? And we can look at the content and the scope, and also the tactics, the shock and awe, or the flood the zone tactics, which are making everybody nutty. And the answer to that is it's arguable, and people have some, reasonable guesses, and others not so much. So he has a bevy of executive orders. Some of them might seem trivial, like banning the federal government from using paper straws and requiring plastic straws, or abolishing the penny, which is our lowest form of currency, our smallest form of currency. Are those legal and constitutional? They may conflict with statutes passed by Congress. At this point, nobody's really challenging them. They certainly seem misguided, but are they illegal? Given the gravity of other executive orders he passed, we have not yet seen whether those kinds of executive orders are legal. But the birthright citizenship challenge, the executive order removing birthright citizenship, or the one getting rid of USAID, or establishing the Department of Government Efficiency under Elon Musk, or the pause on all foreign assistance. Those are much more consequential, and they're all being challenged in court on various legal and constitutional grounds. I will just pause here for a moment to stress that whether or not these executive orders are legal, they've happened. They've caused damage. The spigot of US money, which will discuss all the foreign assistance except military assistance to Israel and Egypt, have been shut off. And despite court orders in some instances, which there's even been a contempt order against the US government, nothing has moved money to places where it needs to go. Now, should some of this aid be reinstated, the money will be restricted to advance US national interests only, which according to Project 2025, which is very much in play, this means there'll be no money for climate change or remediation, and likely the money will go for extraction projects. There'll be no money for SRHR or SOGI, as it furthers the so-called gender ideology, and likely money that will advance heteronormativity and patriarchy will go ahead. There'll be no money for anti-discrimination or positive discrimination efforts, unless it's to advance Christianity. And likely money to promote white male Christian supremacy will take up the slack. So I'm sure we'll discuss this as the webinar unfolds. Now, why is this going on in an unchecked way? Well, if the system were functioning, it would be checked. But let's just say the system is not functioning in sort of the way that we in law school were taught about liberal democracy or in civics lessons. Right now, the Republicans hold Congress, and the political capital and the stakes are very high. So the Republicans really aren't doing anything. They're just letting it play out. The menacing tactics of Trump and Musk, moreover, have really cowed the entire Republican Party in its dissent. The Democrats don't have a lot of tools at their disposal, but there is a continuing resolution that needs Democratic support in Congress to keep the government open. And there's going to be a debt ceiling vote as well. And if the Democrats don't go along with the Republicans, it could at least give them some leverage. We'll see. That's going to play out in the middle of March. You know, right now there is a lot of support from right-wing social movements like MAGA. Maybe you've read a little bit about some pushback in certain locations, but for the most part, the polling is the country loves Trump, the country thinks Musk can do no wrong. And the conservative legal movement, which I'll talk about just briefly, has really the fruits, it planted its seeds in the 1970s. It has realized its fruits right now. So that's why it's so hard to get any checks against what Trump and Musk are doing. That said, we see some resistance starting. And let me just also say, in this month and a half, it's been like unbelievable transformation of American political culture, but at the same time, it's very new. So let's not despair quite yet. Now, what are the stakes of all of this? It's certainly our belief in judicial supremacy, that the Supreme Court, that the federal courts, they interpret what the law says and that the rule of law is endangered. And I think that's really something that is clear and present. we see the triumph of conservative legal thought. And I won't go into the details of what this means, but there are plenty of very well-positioned legal scholars who have been promoting this idea that the president was meant to be a Roman emperor. So just think about that for a moment. And then, there are all these cascading effects, which I won't go into. And I just want to end with saying that it is dire, but there have been plenty of very bad executive orders. I just want to recall one, which was Executive Order 9066, passed by a president that we all lionize, FDR, and that interned more than 120 Japanese Americans and ethnic Japanese resident in the United States during World War II. And it took quite a lot of Supreme Court cases to get that executive order retired. So just saying, it may seem like we've never been here before, and maybe we haven't, but we do know, I think, the way forward. So over to all of my colleagues here on the webinar.
Thank you, Mindy. So I'm turning to Onikepe Ovolabi, who is the director of international research at the Guttmacher Institute. Thank you so much, Onikepe, for being with us today. The Guttmacher Institute has been documenting the impact of the global gag rules at various Republican administrations, and we are now turning to the global aspects. We will go back and forth between the US and global. Can you tell us a couple of words how this executive order on the global gag rules is different from previous executive orders on the same subject, and how it intersects with other executive orders, for example, on foreign aid, in terms of providing and accessing sexual and reproductive health services, not only on safe abortion, but also on contraception, services on maternal health, violence against women, and beyond. Over to you, Onikepe.
Thanks, Esther. And I think Mindy set us up really nicely. And like she said, I will try to go not too quickly, but I'll have to go quickly. So I think the short answer, which many people might be surprised at, is we actually don't know yet what the full impact of the global gag rule will be. But then the long answer is that I'll give a brief background on the global gag rule, and then I'll sort of tell you where we are with the two executive orders Mindy talked about, so the 90-day review period and the stop work order, which have sort of made it hard to understand what's going to happen to SRHR in the future. So for those who are not deeply intimate with US policy, the global gag rule is also known as the Mexico City policy, and it has been in place under every Republican administration since Reagan, and each time it builds on the restrictions in the Helms Amendment. These two sort of play off each other, and the Helms Amendment is important because it restricts the use of any US foreign assistance to pay for abortion. The language they say is as a method of family planning, and it is usually applied as a total ban on abortion services and information with US funds. Like many legal scholars say, the Helms Amendment is inherently problematic because it doesn't take account of a country's own national law and policy. So for example, in Ethiopia and Nepal, where their laws are more liberal, any health facilities that take US foreign assistance cannot abide by their own law and provide safe abortion services to women. So the Helms Amendment has consistently curtailed people's own autonomy and sovereignty in line with their national laws. And of course, it serves as a deterrent to progressive and liberal laws in other countries. Now, what the global gag rule actually does is a step ahead of the Helms Amendment because it blocks non-US organizations, so think of big NGOs or other institutions around the world that receive US global health assistance, from using their own non-US funding to provide abortion services, to refer people to abortions, or to speak out in support of abortion access, regardless of their country's own domestic law. So it basically ties their hands and says, if you take money from us, even if you're not going to use our money to provide abortion services, you cannot use any other money you have to talk about abortion, to refer people, to advocate for it, or to provide services. In the first Trump administration, they reinstated the global gag rule in January 17, and then they expanded its scope. And as I describe its expanded scope, this is the exact same global gag rule that has been reinstated via executive order in this Trump administration. So before Trump's first term, and before now, the global gag rule only applied to family planning and reproductive health funding. But under Trump, it covers all US global health funding. And that means it moves from restricting about 575 million US dollars per year to about 12 billion US dollars by covering all global health funding. The policy is also expanded so that any organization that has to sign and comply with the global gag rule cannot subgrant funding to other organizations that can engage in activities restricted by the GGR. So even if you said, I will sign it and I won't do it, but I'll give a subgrant to a partner, this version of the global gag rule, which was reinstated under Trump, prohibits you from doing so. So like I said earlier, Helms is about what you can do with US dollars, and the global gag rule is what you could do if you received any US funding. And it's driven by a very strong anti-abortion ideology. However, even though the global gag rule was reinstated under Trump, what has sort of affected the global SRHR landscape is more the pause on foreign assistance. Now, foreign assistance for international family planning and reproductive healthcare has been one of the best investments the US has made in global development. And the US does underinvest in aid as a proportion of its gross national income, but it is one of the largest donors for reproductive health and maternal health in the world. Traditionally, US investments have received decades of bipartisan support, and the investment in global family planning has been relatively stable at about slightly over 607 million, and then it supports UNFPA with additional funds. Now, that amount of money, based on our modeled estimates, have provided 48 million women and couples with access to modern contraceptive care. And we model that it helps prevent about 17 million unintended pregnancies and 5 million unsafe abortions. And this ultimately has saved about 34,000 lives. Now, through this stop work order and the wholesale dismantling of USAID and all of the programs they've supported, including this commodity supply chain, health worker salaries, and just the general health system, and the amount of time that has been invested in decades of ensuring that the health system is functioning, USAID, the removal of foreign assistance, the stop work order, the dismantling of USAID has pulled a plug on access to essential healthcare for people worldwide. And every day this freeze remains in effect, the trajectories of the thousands of women and the millions of couples who have access to family planning care, to maternal newborn care, to adolescent comprehensive sexuality education, and to gender-based violence care continues to be affected by this policy. Now, whilst, like I said, the freeze on foreign assistance has pulled the plug on all of this, the global gag rule is in effect because there's currently no foreign funding being allowed to implement global reproductive programs. We don't know what an expanded global gag rule looks like. The only thing we sort of have is what is in Project 2025. So they've recommended applying the global gag rule to all foreign assistance, even outside of global health. And like Mindy has said, all foreign assistance has stopped except defense funding. If any of it comes back, we don't know in what form it's going to come back and if the global gag rule will be expanded in that way. They have asked that the exemption there should be a removal of the exemption for funding going directly to foreign governments. This will mean it won't just be NGOs and other organizations. Any money the US gives to a government would be roped into the global gag rule. And they've also advised that Project 2025 advises that this should be imposed on US organizations. Traditionally, this policy has been applied to non-US organizations. And if this is implemented, we would anticipate challenges in the courts, as this would limit the freedom of speech of US-based organizations. And the other exemption, which is the most heartbreaking one that Project 2025 recommends, is that the global gag rule should be expanded to cover humanitarian aid. This is particularly challenging because humanitarian aid often needs to be nimble, to be administered quickly. And we know that women who live in humanitarian contexts often experience a really high level of gender-based and sexual violence and are often in acute need of access to SRHR services of all kinds across the spectrum. And this would have devastating consequences on them.
Thank you so much, Onikepe. Just a technical question to Lisa, who is helping with this webinar. That Lisa, is it possible to put questions and thoughts into the chat? I'm not sure that I cannot see actually the chat on my computer. So just if you could give instructions on that. And in the meantime, on the chat. In the meantime, I'm moving to Anand Tamang, who is the director for the Center for Research on Environment, Health and Population Activities from Nepal. Hi, Anand. It's very nice to see you here. It's a little bit late, so thank you so much for joining. We have been working for many, many years, and you have like almost 3 decades of documentation of various global gag rules and its impact in Nepal, and also collaborating with other countries, sharing methodologies on how to document the impact. And you were also the guest editor, co-guest editor of the previous sexual and reproductive health, the 2022 Sexual and Reproductive Health Matters journal that was documenting the impact of the previous global gag rule that was implemented by the previous Trump administration. Now the situation is a little bit more complicated than before, and you told me that you are currently conducting a rapid assessment of the global funding freeze in Nepal, particularly in the health sector, and how they are severely affecting sexual and reproductive health and rights. Can you please tell us more about your research and your findings?
Thank you for having me, Esther, and hello everyone. It's good to be here, presenting some of my summary of results. Let me just hover around our key findings from the global gag rule impact. That's a short one. Then I will discuss more about the executive order. So even now, the impact of global gag rule has been quite severe in Nepal, especially for the NGO sector, in the sense that we have heard about what are the do's and don'ts of the Mexican city policy or the extended global gag rule, which was implemented in the Donald Trump first round. So we have we have seen that although there are certain ways of providing safe abortion care or referring your clients to a safe abortion care clinics, but there are some chilling effect which we have observed. Chilling effect, I mean, is a over-interpretation of the global gag rule policy. As a result, like NGOs who have been involved in legalization of abortion in before 2002, and who have been providing all these important services in increasing access to safe and legal abortion in the country, are having a funding, constrictions, a crunch, in the sense that such organizations who are providing such important services for the Nepalese women's reproductive rights are not being involved as a part of the consortium. As you know, that US aid in Nepal is one of the biggest, sources of funding for the NGOs. But since an organization like FPN have declined to sign the policy, they have been, excluded from, coming into the consortium. So as a result, now we have seen the latest data is that at the time when they had a larger funding in 2000 and 2021, there were 44 clinics run by FPN. As you know that NGO contributes significantly in Nepal in providing safe abortion services. It's 34%. Government contribution is 37%, and remaining 29% from the private sector. So when an organization have a shortage of funding, they have been pushed, they have been forced to, remove or shut down 12 clinics. Out of 44, now they have only 32 clinics that provide safe abortion service in Nepal. As a result, the flow of clients also haven't reduced drastically in the last 3 years. In 2021, they were serving around 9,650 clients. This reduced to 7,600, which is about 21% reduction in their service delivery. So the chilling effect has been is a misinterpretation of the vaccine policy that has really affected organizations like FPN and also like Mary Stops International and other NGOs who are providing safe abortion care at some extent. So the fact is that if there are no alternative funding sources like the large anonymous donors are going to come back to Nepal and help these organizations, I think access to safe abortion service in Nepal will go down, and women will be forced to seek unsafe abortion services elsewhere, even by crossing the border. We have an open border with India. So those are some of the, outcomes of the global gag rule. And we know not, we have been already heard from on the KP about the possible, how the global gag rule and the new executive order is going to further aggravate the situation in Nepal. Now, I would like to discuss about your global, funding fees, which was introduced just about a few weeks ago by Donald Trump. With the support from the Brun Department of Population and Family Health from the Columbia University, USA, we are doing this rapid assessment, as you have read out the title of the study. This rapid assessment, we are still continuing. We have just completed phase 1, where we have visited some of the organizations who have been the recipient of the US money and who have been asked, ordered to stop. So we have tried to talk to them. And as we have seen that now, the impact of this has been seen from the fact that the organizations who have been told, to stop the work, have to shut down the clinics. They have to tell their staff to stay put in their homes and not to attend. This staff and even the organization NGOs who have been implementing the projects funded by the US aid are in a confusion. They have not been told all in advance. They are not given sufficient time. So they are not sure if this for 90 days, whether the staff will be receiving their salary after 90 days. First thing. Second thing, it is seriously hampering the clients, especially clients who need life-saving drugs. Clients like the HIV survivors who need the ART drugs to survive, who need to control their virus load. And if virus load are not controlled, and if they discontinue taking the ART tablets or the medicines, the repercussions are, deadly, in the sense that they might spread HIV to their partners, or they might themselves contract infectious diseases like the tuberculosis, pneumonia. So the likelihood of fatality among those who stop taking ART drugs on a regular manner will be, we know everyone. So these are this immediate impact for those women who seek services from the clinics run by the NGOs through the US fund. And in another situation, we have seen that the adolescents, there's a large-scale project on which is called Adolescent Reproductive Health Services. And there's another project which also on micronutrition, like breastfeeding practices. The government of Nepal, the Ministry of Health have been forced to lay off 36 staff nurses who were being posted in 18 federal and province level government hospitals. And by laying them off, the women giving delivery at those hospitals will be, they don't have access to those services, training on, the counseling services about how to ensure exclusive breastfeeding for the young neonatal babies. As you know, that Nepal, in some of our provinces, have one of the is known for reduction in breastfeeding practices, absolute breastfeeding practices in some of the in marginalized communities in the country, including in Madhya Pradesh. So these are some of the impact of the executive order. They have frozen the fund for at least for 90 days. They do not know what will happen after 90 days, whether the project will continue or, so nothing has been told.
Yeah.
Another impact is that at the moment we are getting this information from the service providers, from the government stakeholders. We don't know what is going to happen with the women who need these services. So our next phase will be go to the community, talk to this eligible women who have been denied the services because of this executive order. So our research is not completed yet. So maybe in the next time we will be able to share with you the findings from our research. Thank you so much.
Thank you so much, Anand, and it's devastating, and I think it's very clear that the similar situation is happening in many, many countries around the world, that it goes beyond to access to safe abortion services. But what is also very concerning, that why the US turned around understanding of the Constitution around access to safe abortion services. In the past 30 years, more than 60 countries, including Nepal, made safe abortions accessible and safe, exactly to save life and health of women and those who are getting pregnant or don't want to stay pregnant, or their life and health is endangered by unwanted or otherwise different forms of pregnancies. And these executive orders are actually interfering with health policies that is serving the health interest and saving lives around the world, and interfering with the sovereignty of the countries in terms of making their own legal grounds for availability of services. So moving on and turning to one of the most difficult to understand executive order on that is connected to gender ideology, and many executive orders that is difficult to understand from the public health, the evidence, the scientific, the human rights, the basic being a human being in a decent way point of view. And Ellie, I'm turning to Ellie Miller, who is a professor in practice at the Yale School of Public Health, associate professor at the Yale School, co-director of the Global Health Justice Partnership of the Yale Law and Public Health School, and executive and a member of the editorial advisory board of SRHM, and Anand as well. So Ellie, how do we understand the executive orders on gender ideology that is severely and directly impacting transgender people, not only in the US, but all around the world? They have there is an impact on all aspects of transgender people's lives. And it's these various executive orders are going back to the executive order on defending women from gender ideology and restoring biological truth. I think many of us read probably this executive order 50 times to be able to understand what it actually means, how is it grounded, what does it mean. I guess you have a difficulty to understand, but can you help, Ellie, to understand better both on the aspect of defending women and on the aspect of biological truth and any other details of it?
Well, thank you. But I think my goal is to remind us that the mechanism by which this executive order is functioning is incoherence and fear. It is not coherent and it doesn't make sense, but it can make harm. And I think understanding and thinking back to the work of, many of us on this call, Sonia Correa, Judith Butler's recent book about the point of attacks on gender ideology is that they are rolling up many incoherent ideas, but they have very concrete harms attached to them. And the attempt to make sense of it is also a busy work for us. What we need to do is pull it apart and resist it in different forms, but not try to explain it because it is idiotic. However, it is powerful, right? So we need to work with that truth, that it is idiotic and powerful and malevolent. And I'd like to speak about that. And thank you, in particular, Mindy, for setting out the way in which the whole shape of executive orders are manifestations of presidential power. And I think that's an important reminder that the way in which this is functioning, both in its illegality and whenever it may be found to be legal, is also part of concretizing and authorizing an imperial presidency. So think of that as one of the political goals, and that the fights over gender and the fights over the way in which both the US in part and international human rights law in part and sexual and reproductive health practices in part had begun to embrace much more progressive, coherent, and inclusive understandings of gender. So this is an attempt to break those apart, and in breaking them apart, to assemble power for a particular president for a particular time. And I think we need to be very clear on that, which also allows us, I think, and this, when I get to my close, to think about what our response, our resistance should be. So when I said it is both idiotic and it is also an ideological blueprint for action, right? It is a manifesto that is working through both its direct impacts. And I know that Erica will speak much more specifically around a range of the what I call progeny, or we might call spawn, i.e. the offshoots of this executive order on gender ideology, have some very specific direct executive orders that have followed, targeting trans people. And I think Erica will speak more generally about them, but just to name the specific categories of harm, they have to do with trans folks in prison, particularly trans women. And I hope Erica will speak more about the sort of asymmetry and the invisibility of a range of gender nonconforming people and trans men in these conversations, and the targeting of trans women as a site of fear. So the focusing on trans women in prison and removing them. Then there is a focus on trans people in the US military. There is a targeting and a threat to end support for practices that at different state levels that provide gender affirming care for people under the age of 19. There is the attack on trans, again, girls and women in sport, and there is the attack on trans people's adequate or more accurate identification in passports. So all of those are the specific spawn of this general executive order on defending women from gender ideology. But I want to speak about a couple of other aspects of this very wide-ranging executive order. It also, because it is talking about defending women, it's important to notice what it includes as a form of defense of women in this executive order. It is defending women for the safety and security in prison. Prisons, incarceration are never safe spaces for anyone. So the notion that this executive order, by virtue of targeting trans women as the threat, which is an artificial threat, as we know, pretends to make prisons safe for women, which is to justify the horrible incarceration practices and conditions that women and girls face, or people in any form of incarceration in the United States or elsewhere. So the ideological work of defending safety for women in prisons is to make prisons safe, which is absurd, and to target trans women as the site of danger. This is a bait and switch away from all of the efforts in the United States and globally to end over-incarceration and to improve the ability of people to avoid prison as they change their lives, right? So what's one of the effects of this executive order around defending women from gender ideology? This kind of strange securing safety of prisons. Another one, and this goes to the question of how science is implicated by this executive order. The title of it, of course, has this notion that the legitimacy of the US government is built through speaking some kind of biological truth, right? And this is extremely troubling in many different directions. On an ideological level, what it is saying is that on the one hand, government support for scientific investigation, which we want to hold on to, becomes government support not for rigorous scientific and curious scientific investigation, but scientific investigation only what upholds ideological beliefs that are preordained. And I think Mindy mapped some of them out as they are made visible in Project 2025, and also Onakepe's statements about the way in which different forms of untruths about contraception, abortion, and gender difference, and the biologies of differently sexed bodies, those are all being eviscerated, and the ability to speak about them. So one very concrete element of this manifesto about biological truth held by a certain administration, one concrete example is the fact that under a memo which operationalizes this executive order from the Office of OPM, Personnel Management, a memo required that HHS, the U.S. Department of Health and Human Services, clear certain words, scrub words off of a range of key databases held by the Center for Disease Control, National Science Foundation, or National Institute of Health. And this particular scrubbing order, that words were taken down, words around gender diversity, words around inclusion, this scrubbing order has been challenged by a range of both scientists and clinicians on the grounds that if you remove the capacity of clinicians to have access to comprehensive data about the communities which they serve, they cannot provide ethical clinical care. Simultaneously, scientists whose publications have been pulled are challenging, saying, it is a censorship of our ability to publish what is ethical, scientifically integration and integrity of science about the populations that we work on. If we can't use the words and you're telling us we can't publish, you are violating our abilities both as with scientific integrity and our different First Amendment rights. I want to pause here and go back to something that Mindy had mentioned in regard to the legal structure of this. Almost all of the current pauses that have succeeded in U.S. courts are called temporary restraining orders. And early on, I think we popped into the chat, one of the most useful resources for tracking what is happening in U.S. courts, what the executive orders are and where the challenges are and what their status is to be found in this Just Security Litigation Tracker. And for people who want to follow closely, it's updated every 24 hours. These TROs, temporary restraining orders, are just that, temporary. So that means that a court found the extraordinary, found under a high burden of proof that the plaintiffs, the people who brought the charge, would suffer irreparable harm. So these TROs have been issued in some cases but they will be further litigated. There will be injunctions where they can be appealed, and then all of these cases will go forward. So, and I think it was Onakepe who mentioned we are in a time of great uncertainty. So the uncertainty of how all of these different pauses will be dealt with by U.S. courts is great. And it's part of what Mindy spoke to in terms of a general breakdown of what those of us who went to U.S. law schools were trained in, which is rule of law and the supremacy of court decisions. I'm going to close with a thought about the way in which our resistances and our challenges might go forward. Part of what I think is so important about the way in which the scientists are challenging the shutting down under the executive order and the specific memos coming out of different parts of the federal government is they're making clear the distinct harms and the distinct populations and exactly how the harm is working. So the work that Anand is doing to do documentation of how the harm is happening, the distinction about who is being harmed and how they are being harmed will be important in convincing judges of the reality of that harm in the long run as these cases go through the courts. But I also think it gives us an opportunity to rebuild a gender solidarity coalition about how the construction of gender matters for everyone, so that we understand that the attacks on trans persons are also part of putting cis women in their place in a normative form of protection where they must be protected from freedoms. And I think this can help us rebuild coalitions, and perhaps we can talk more about this later. And I look forward to Erica giving us much more specifics about the particular harms that trans folks face. Thank you.
Thank you so much, Ellie. So I'm turning to Erica Castellanos, Executive Director of Global Action for Trans Equality Gate. Thank you very much, Erica, for being with us today. You are connected with transgender people around the world, and I guess you have been extremely busy and probably tired. And there are no words for that, what your community is facing. Can you please tell us about the global impact and the experiences of transgender people around the world?
Thank you very much, Esther, and thank you to the previous speakers. I want to start first acknowledging, that for many of us who were born and lived in low and middle income countries, the realities that the global community and our siblings in the US are facing is what we grew up with. So I think that is something that we should share, but also I want everybody to look at me, at this evil trans woman who is all-powering and causes hurricanes and earthquakes and it's putting people in danger. As it is said, sometimes I do wish I had those powers invested in me. We have seen in the past few weeks the main impact that has happened overall is a lot of confusion, a lot of questions that go unanswered, a lot of misinformation, and with reduced resources comes a higher level of competition for minimum resources for the community. I think what we need to understand that this is exactly the effect that it is wished to have. And I really, in the conversations we have had with our partners, we are calling for a unified front because we cannot give them what they are trying to provoke, which is to dismantle movements, to fraction civil society to the point that we cannot operate. Again, using trans women in particular as political tokens, as instigation of fear, of sharing a lot of misinformation. I think it causes a lot of panic in people who are not educated on the topic, and in some cases do not wish to learn on the topic. We are seeing around the world, and particularly regional networks. We have in Asia and the Pacific, Eastern Africa, Europe, Central Asia, Latin America, and the Caribbean, the Middle East and North Africa. We have collected some information. And in some of these regions, the regional networks have lost 100% of their funding. Not because they got grants directly from the US, but the other grants that they had were coming through intermediaries, which the source was from the US. We as an organization are also impacted in that situation. I do recognize we are in a very good place per se. We have zero direct funding from the US as an organization. In fact, we have zero direct funding from any government. And this has been a conscious decision we have made as an organization. But we do have some funding that has been affected because of the donors. Their original funding comes from the US. In particular, one of the key things I want to share is the impact of the funding collapse around access to care. We have collected information from 46 clinics that have a focus on providing care for trans and gender diverse people. They operate in all the regions of the world, and many of them receive funding coming out from the US. 95% of the funding for these clinics is at risk at the moment. We strongly believe that we will not get that funding back. We know our colleagues in the US are fighting back fiercely. But I want to be blunt. I don't think there's anything we can do with the current administration around issues of trans people and gender diverse people, non-binary people, and particularly trans women. The vile attacks and use us as political tokens will not stop. And we saw that from the political campaigns. The millions spent during political campaigns on ads against trans people was unprecedented. These clinics, I want to make it clear, none of those clinics provide surgeries. None of those clinics use US funding to buy hormones. Those clinics provide STI testing and treatment, HIV care, counseling, and particularly prevention of suicide in many of the countries. And they do provide gender affirming care, but those are restricted in many instances to looking at laboratory diagnosis and the provision of hormones in the clinics that provide hormones is done through own funds, subsidized funding from either the local government or small fees that the users pay. Many of these clinics now, the users are being turned away. And in many cases, they are located in countries that do not provide gender affirming care. And that was the only hope for them to access care and not have to go to underground practices and very dangerous sometimes that we have seen getting medication in the black market and not being able to really have laboratory diagnosis on hormones. We have seen the loss of access to critical healthcare. We're seeing backtrack in legal recognition. and protections from violence. In the US, colleagues are reporting on the access to their documents, for example. Some have received their passports, who recently went through the process with their genders taking back. And it's really worrying. It has emboldened many states around the world to be more hateful, to institutionalize laws, policies around removing protections, but also removing basic rights for trans people. It has set a ripple effect across other countries. It has weakened, to my view, a global movement that was just starting to peak, and it strengthens anti-democratic forces. I think some of the speakers have highlighted this erroneous stat when people think that all the work and all the hate being done against trans people only affects trans people. Nothing can be further from the truth. It is affecting everyone. It's affecting children, men, it's affecting women, cisgender women, in the ways where we are seeing a regression of the hard-won rights of women in decades, centuries. Decades of community organizing, policy wins are at risk, and in some cases being undone. Not precisely overnight, but it is being done. Systems are already being put in place to undo those gains. Again, I want to really emphasize that this is not about trans rights. It is not about it at all. It is the collapse of funding that weakens democracy. It weakens human rights, and it weakens global justice for everyone. I want to end with sharing a few recommendations that we at GATE has shared with our partners, allies, and particularly donors, is to ensure that there is core funding for trans groups, that we enable rapid response mechanisms, and these do not always have to be in the form of money. There's a lot of need around technical assistance, particularly legal assistance, as many organizations are navigating the stop work orders against legal compliance in their countries. We need to really invest in regional healthcare access programs. And I think the most important thing is to take what is happening with the stop work orders from the US as an opportunity for us not to find in this situation in the future again. I think it's an opportunity from the perspective of civil society to build innovative resource mobilization mechanisms for movements to be self-reliant and strengthened. I think we need to enact the buzzword sustainability that we all love to use, but sometimes don't know what it means. Now is the time to act on it and really, really support movements across. Another final comment from my side is the need for cross-movement collaboration, not only for advocacy, but to have best value for money, is that we need to stop working in silos and really come together, recognizing that what makes us different is what makes us unique and special and brings strength to our movements. Over to you, Esther.
Thank you so much, Erika. Thanks a lot. So turning to you, Alan, to pull all this together, and talk about the actual practical implications. You are in many places globally that boards of global organizations that provide services in especially in Africa, regional, national, grassroots level movements. What is the actual impact in regionally and in Kenya? What do you do? What are the experiences, both politically, legally, public health impact, how it comes together, Alan?
Thanks. I think it's difficult to bring anything together, but the fact that this is a very horrible situation to be in, and it's good we are having this conversation, but the reality of my experience, whether in Kenya, whether in the African region, or in the global spaces I sit in, is that everyone is worried. Everyone is uncertain of what's going to go forward, and everyone is very cagey and pensive around what they say, what they do, who they speak to, and what they put out on their social media platforms. So it's a very uncomfortable, very unlikely situation that we've not been in before, at least on matters concerning the stop orders to provide services. And so I'll look at it because most of the colleagues have covered some of the issues I was to speak to. Looking at it from my point as a human rights lawyer who works in Kenya, across Africa, and also sits in global spaces, I think the best I can say is that indeed, from what we've seen so far, the executive orders have indeed far-reaching consequences beyond the US borders, and the consequences are much more for countries that rely heavily on foreign aid for health services, for humanitarian services, and also for SRHR services. And so we cannot downplay that. You cannot undermine that. And that is something we must realize, that mostly countries who are dependent on funding are the ones who are most hit at the moment by what is going on, especially in the health sector, and the humanitarian sector too, and that has very diverse consequences. From a political perspective, the sovereignty and policy influence is something that comes up. The moment the Trump administration came in, they went back to signing a document called the Geneva Consensus document, which is a document that is signed on by governments who are not very progressive about reproductive rights. And politically, you will then see the move starting again with people who are seeking for aid, or government seeking from aid from the US being coerced to join this document that even is retrogressive to some of their constitutions. Kenya is an example of a country that has a progressive constitution on reproductive health rights, but has signed on the Geneva Consensus. So we are going to see more of these countries being coerced to sign and take positions in global spaces, in regional spaces that undermine their own national laws, that undermine their sovereignty, and obviously affect the affected communities. I've already talked about the chilling effect on advocacy and people speaking up. And this not only applies to civil society organizations, I have also seen it with colleagues in multilateral organizations. I've seen colleagues in the UN who may not be comfortable to drive conversations on these issues in public forums. And so with executive orders, with the stop orders to work, there's a whole chilling effect around the freedom of expression, the ability of people to speak. There's even now language and guidance that is being sent to people who run services to not use certain words, to not refer to certain populations. And that, of course, has the consequence of making Erica and the people from Erica's community become invisible. People are now presenting in clinics as, for lack of a better word, normal or straight people, so that they can avoid not being denied treatment, which then takes us back to a situation where people have to hide their identity, people have to hide who they are, and that, of course, has got consequent effects on their health, their mental health, and their ability to maintain and live dignified lives. So that remains a problem. And then thirdly, on the political implications, and we've seen a bit of this, there is now increased anti-rights movement who are fueling conservative, or rather conservative groups and anti-rights movements are really getting emboldened with the presence in the US, the position that is being taken. We have seen politicians congratulating, supporting some of the executive orders. We have seen certain special rapporteurs welcoming special orders on official UN letterheads, which is very worrying because some of those orders actually go against agreed international principles. And so there's a worry that we will see most of these movements getting emboldened, as Mindy said. They will get more funding, while those who believe in the right thing will get less funding, and the scales will tilt further because they've already tilted now in many countries. I think the health issues and the public health issues, Anad explained them very well. I think the impact on the HIV response is not something I will emphasize, but I think the long-term effect of this is that you will find a loss in all the gains we have made in the HIV response. The gains we have made to ensure that people living with HIV are taking ARVs daily, they are living normal lives because then their virus is undetectable, it's untransmittable. The thought of disruption in their services, the actual disruption of services they have faced is something that will really reverse the gains and will not even achieve the SDGs we have set aside. In terms of unsafe abortions, Oloabi spoke well to it. We are going to have situations where we have organizations who do SRHR work, do HIV work, do TB work, but because they are getting money from USAID, they'll have to make a difficult choice. Do I drop my TB work so that I don't get gagged to speak about SRHR and safe abortion? Or do I take the TB money to be able to keep people in employment and then drop away from the SRHR work? So we're going to find ourselves in such situations, and Kelly as an organization is in a similar situation. We're just waiting to see, after the 90 days for a TB grant we ran, shall we be told to sign a global gag rule? And what will I then do in the situation in terms of that? So it's a very difficult situation we find ourselves in. And I think the LGBTI community, particularly the trans community, even though they are criminalized in many of the countries, the executive order is making this worse. It's making it worse in terms of the misinformation, and any fragile gains that we've made becomes a problem. And this is also applying to adolescent girls and young women in various ways, especially if you take a religious and fundamental perspective. So I think to sort of bring it together is that we're in a very dire situation. We definitely need solidarity across movements, across disciplines, whether it's climate change, whether it's LGBTI, whether it's health, because singularly no one will be able to be funded to deal with all of this. Singularly, no one will be able to fight against this. And I think the bigger challenge is that it's not just the US. We are seeing a rise of right-wing governments. We saw what happened yesterday in Germany. We have seen the Dutch government being clear that trade and climate change are their priorities. And so we are not in a situation where we are going to see other donors saying, we are here, we are stepping up, we are fighting the US. We are likely going to see a conversation where people say, we are aligned, and this is how we are moving forward. And that then leaves civil society, affected communities, agencies that promote human rights in a very precarious situation. And so we really, really have to try to regroup, try to work in solidarity if we want to make any gains in at least holding the line on the things that matter for all human beings. Back to you, Estelle.
Thank you very much. So I'm turning to Luisa Cabal, who is the director of the Regional Support Team for Latin America and the Caribbean at UNAIDS, SRHM editorial and advisory board member. Luisa, can you go into more practicalities, since your organization and your network and whom you are working with is directly impacted as well? What's happening in the HIV world in the Latin American Caribbean region, and how are you addressing it?
Yes, thank you, Esther, and good to see you all friends and new friends. let me just start by saying that the U.S. leadership on the AIDS response cannot be underestimated. I think many of you have been engaged in one way or another, but I think it's sobering when you think that 26 million lives have been saved thanks to PEPFAR's, the U.S. government's leadership, and that in 2023, more than 20 million people were on ARVs thanks to U.S. government funding. So when you think about a stop work order and the impact and the immediate impact that this had, it has been really literally mind-blowing. And so the advocacy that has and is undergoing to make sure that there's some continuity is critical. For now, the waiver on life-saving, just to put it in very simple terms, most of the waiver for HIV has been on life-saving medication and approaches. So this only has supported one of the pillars that UNAIDS strategy says we need to get to our goals of 2030, which is around no more deaths. But there have been a lot of challenges, even in implementing the waiver, as many of you have heard. And so one of our work in our daily work is to support partners navigate how to get back to services, how to get implementing partners support to make sure that they're providing that life-saving work. But we also know that there are the other two pillars of UNAIDS strategy, centered around prevention and centered around the structural drivers of the epidemic. And we know that those are frozen. And so what we are working in from the Latin America perspective, and my colleagues around the globe, is on several fronts. And of course, one of them, and I think we also need all of your supports from where you stand, is documenting those impacts. And I know that we've heard a lot on documenting impacts to make sure that we make the case. We make the case, of course, to the US government, but we make the case to other donors and to our own countries, and I'll get back to that, on why we need more action and urgent action. Just to be very brief on some of the impacts that we're documenting, of course, PEPFAR was being a leader around prevention, and because governments in our region, whether they're high income, middle income, they were not really covering prevention services for key populations. So the provision of combination prevention services, the promotion of PrEP as a prevention tool, that has been halted. And that's one of our sources of concern, prevention services for key populations. But there are also some issues that get more invisibilized, and I want to make visible here. You know about the migration crisis in our region. And I think that PEPFAR, along with the Global Fund, were really supporting, they were documenting the impacts, the vulnerabilities of migrant people in our region and providing key services. And let me say that a lot of governments, including my own Colombian, had been establishing laws and policies to absorb and to provide health services to many migrants, but that is not enough. And I think this is where these donors were really supporting the provision of, in our case, HIV services for migrant services. So I would like to put a spotlight on that because that is often not talked about. But also, recent research had also shown how indigenous populations, whether it's in Peru, whether it's in Central America, there are challenges and high HIV prevalences in many of these indigenous groups. And unfortunately, due to the stop work order, there have been challenges in reaching, right, and providing continuity of services to those populations. So those are some of the issues that we're trying to raise awareness about with the governments. I don't want to give a lot of country examples, but I would just put a spotlight again on Haiti. Haiti, we have a humanitarian crisis, highly dependent. PEPFAR covers around 60% of the national response. And even though our director there is working day and night to make sure that the waiver really allows for continuity of services, there are many challenges to make sure that we continue to support that provision of services. So what do we do? And I want to echo what all of you had said in terms of the work and the solidarity and supporting movements and most impacted communities in the front lines. But I also want to say that we need to hold and to promote more accountability and dialogues with the governments. This crisis also presents opportunities, and this is where we also need your collective support in how we make the best cases to the governments to invest more in their own populations and in the gaps that are being left. And I think this is where we have a window of opportunity in the crisis, and where we really need your support. So what are we doing on this front? We're trying to make the case, right? Economic case, where possible, around why it makes sense for these governments to make sure that they invest now and they invest in those gaps. We're trying to work on that in Central America, where there's the biggest gap right now in PEPFAR. But building on the sustainability work that we have been working and really accentuating this is critical. And it's what communities, we just did a survey with communities. And I think one of the big asks from this survey and from the dialogue in Latin America has been, please be a bridge to dialogue with the government, right? There's a realization that we need that dialogue and that increased not only accountability, but dialogue with the government. So I would just say, I invite you all, because I think now more than ever, we need to be working collaboratively to document, to support with arguments, and to support really those communities on the front lines that are suffering and are the most impacted. Thank you, Esther.
Thank you so much, Luisa. And you are pointing to another round of questions to everyone. And really, we have only 1 minute. But can we, I think it took a month that we kind of wake up and we try to overcome our initial shock, but we are at the action levels. So what kind of action is needed at different levels from the different point of view where you are? I'm following the chat as well. If any of you would like to address any of the comments that are there, we will share the chat with those who are reaching out directly to us. We won't put it on our blog or anywhere else. Please feel free to reach out to info@srhm.org, and we will send a chat if someone is interested. One question was striking me in the chat, that do we jeopardize our funding for the sake of one single group? Like what single group? The single group of women, the single group of adolescents, the single group of trans, the single group of people living with HIV? Which single group? I mean, so migrants, refugees, those who are in prison. There is no single group here. There is so much comprehensive influence on all different group of peoples around the world. So I go for another round of any reflections. 1 minute, please. Action-oriented. What do you think the next steps are? How can we think about actions, especially addressing the impact that we diagnosed here? Mindy.
Thank you. Just to say, I agree with Luisa that, I mean, it's a moment of inflection about how global health funding and other assistance has allowed certain dominant countries like the United States to really exercise extraordinary influence. Maybe we were supportive for the most part of that influence, but I just raise a question, if this isn't a moment to reassess and to really work at the national and local level to own, you know, the health agenda more locally, and to think about what decolonization might mean in this space. The other point I just want to raise is the entire international system, the UN agencies, all of the entire human rights structure is under enormous pressure at the moment. It's not just the US withdrawal of funding, or as Alan said, like-minded countries withdrawing funding. If you saw what just happened in the Security Council, what we're seeing is a reassertion of this idea of might makes right, and the reassertion of global spheres of regional spheres of interest. It is an anti-human rights agenda And I do think the call for working cross movement and to seeing the big picture is critical at this juncture. I have a lot of ideas that are extra legal as to what one needs to do at the moment, which I will not share, but happily on a secure channel discuss. Over.
And please feel free, and anybody else, to submit your blogs or articles or commentaries to the SRHM journal. We are very happy to publish notes, especially quickly on our blog as well. Onikapa, 1 minute, please.
Okay. Yeah, thanks everyone. And I think I wholeheartedly agree with all the other comments, and especially what Mindy has said. I think this goes far beyond global health, all the way to global politics and what it means to be a nation state. I often joke that we've entered a different political age. It's like you've seen the decline of an empire and of human politics and relations as we know it, and that we already made history for COVID, but we're a generation that's going to make history for redefining what the next era looks like. And so someone had talked about, supporting local governments and thinking of domestic financing and building alliances. But then I think that as we do all that cross work, being able to educate people and introduce advocacy and help them see that it's not a surface agenda, that it goes far beyond the short term into the very essence of what a country is, who has might and who has power, is critical, so that people are making decisions as a humanity fighting for human rights and democracy, even though democracy in its current form isn't functioning quite properly, so that they're not seeing it as meeting short-term needs or stopgaps, but governments and advocates and CSOs and people can be aware of the underlying agenda and can come together to address that, even as we try to fill in very, very massive gaps globally. Over.
Thank you, Onikapa. And we are also very thankful for the Guttmacher Institute to putting out up-to-date information, opinion pieces and data. So it's very, very helpful. So please keep doing that. Anand? Anand is still here. Then I would go to Ellie and I will come back to Anand if Anand is coming back. Ellie?
Do you want Anand? Okay, I'll go and then Anand. So I think it's to say, in saying ditto, echoing this conversation about solidarities and pointing out that these are anti-democratic moves, and also to highlight some of what happened in the chat, the conversation that we both want to use the critical thinking that's gone into dissecting the sort of movements to attack gender ideology and use that as some of the basis for action and not just treat it as an academic exercise. It's real, the analysis that has been done. I think it was someone in the chat who referenced quite a bit of work both in Latin America and Eastern Europe. But I think what we want to think about in doing that and working to decolonize global health is that we need to be clear that our nation states also need to be held accountable to democracy, right? Because regionalism and nationalism itself will not produce inclusive society. So we are in a very complicated bind about working within a new frame of superpowers, trying to be regional and national, and at the same time trying to rebuild locally what a democratic society looks like in an inclusive way. But I think those are the things that I'm trying to hold on to. And I would add that I'm sitting in universities. Universities are under attack for critical thinking, and critical thinking can happen anywhere. So I think one of the solidarities we want is the solidarity of critical thinking across and outside of the academy, put to practice on the local level. So that's sort of what I'm calling for. Thank you.
Thank you, Ellie. Anand, are you back?
Oh, yes, thank you. Well, as a Nepali living in Nepal, my biggest concern is about USAID being, trying to, there are possibility of dismantling USAID, which will be a very sad for many of the countries low-income countries, middle-income countries, because in fact, for Nepal, it is one of the oldest and the biggest funder, and also provided extensively programs. Those help to empower the citizens, the communities through better education, CSC, SRH, contraceptions, and other humanitarian efforts. So we really want organizations like USAID, if it could be, sustained, or the US government could form another, alternative, such agency which could be able to provide services to low-income countries, including those in Africa. So we should contribute, or should do some sort of advocacy to ensure that such humanitarian organizations like the USAID should be retained at any cost. That's all.
Thank you. Thank you very much, Anand. And please pay attention to the chat. I think people started to share very important information. Website. Thank you, Malaya, for posting. Carmen Barroso, you are putting us at the different level of discussion as well. Again, we are saving the chat, and we can share if you reach out. I'm turning to Erika.
Thank you very much, Esther, and colleagues. Agree with everything that has shared. I want to provide 2 final comments based on what has some of the things shared in the chat, and that is looking at always thinking of, we are underfunded, they are superfunded, and that we work in silos and they are united. I just want to say that I hugely disagree with those statements. Big time disagree with that. One thing is that for communities, at least, the lack of funding has never stopped us. In fact, it has fueled us to do the work. So I think we should hang up to that advocacy and that passion to continue and look for other spaces, and particularly on self-reliance. And while many people get the impression that the right or the anti-rights movement, there are all these united front that don't have disagreements, they have a lot of disagreements. There are many things that they cannot see eye to eye. And we should learn what those are, the same way they study us to put us apart and tear us apart. I think the difference is that they're able to put those differences aside and support each other. And that's one step that we need to do.
Thank you. Thank you very much, Erika. Alan?
Thanks. Just 3 quick points. I think the first one is we must be able to find a way to hold the line on science and human rights, because any further space ceded on thing. And we can only do that by trying to use all legal means, and hopefully the other ones Mindy is going to tell us on a different forum as to how we try to hold those lines. But particularly we've seen steps of using the judiciary as a way of trying to push back on a number of these issues, pulling down of dated information. It varies from country to country, but where you have a strong and progressive judiciary, then you definitely must explore the theory of rule of law and see when your government takes something forward, can it be challenged? I think the second part for me is, I've come in from the global south, and we began doing so in Kenya and in other African countries. There are difficult conversations happening with our governments around what then is your responsibility to provide my right to health. Of course, we expect USAID PEPFAR to continue in whatever form and shape, but at the end of the day, as a Kenyan citizen, the Kenyan government owes me a responsibility as per the constitution or whatever international instruments they've ratified. So again, what do we do to hold our leaders accountable at the national level to be able to ensure they deliver on the rights? And lastly, and the long-term solution is that we just need to start organizing now for the next election. And across the world. If we do survive the 4 years, we need to find a way to vote in a way that ensures we do not find ourselves in such a situation, because the leaders we choose are the ones who put us in the places we are in, and we cannot then shy away from the fact that the health issues, SRHR issues, LGBTI issues are political issues, and we're not just dealing with health issues. We're in a political battle that we need to take forth. So those are my 3 thoughts and takeaways, in agreement with what the other panelists have also said. Back to you, Esther.
Thank you, Alan. Louisa.
Yeah, my one message is connect to the local and support the local. I think working in Latin America and talking to many people in the different countries, that's where the people are suffering the impacts. So many gains on community leadership, right, at risk. And I think that this collective group and your allies can do so much to offer know-how, right? Communities are resilient. They've survived a lot. But I think at this particular moment, many tools around creative tools, they even themselves are looking for innovations and are implementing innovative solutions to do continuity of services. But I think I would leave you with that I see that there's a lot we could do just with our know-how on innovations and resilience at this critical time. Over.
Thank you so much, and we came to the end of this webinar. Thank you very much for all the panelists, and it's really beautiful to see all of you, the dear friends, colleagues from all over the world. I think we see each other and we connect with each other in as many ways as possible. So we just continue of doing that. Again, we will share the chat and the recording of the webinar on our SRHM blog. Thank you so much for all the panelists and everybody who contributed to the chat as well. And again, I would like to encourage you to please send us community practices, documentation of voices of communities, research findings, policy analysis, commentaries, and blogs to SRHM. We are very keen on publishing those. Thank you so much, and bye-bye. Take care.